Hey, it's Dr. Hannah with this week's Hot Topic. Today I want to talk to you about nicotinamide. Now, nicotinamide is also known as niacinamide or nicotinic acidamide. It's also a water-soluble form of an active form of vitamin B3. Niacinamide is found in many foods naturally. It includes yeast, meat, fish, eggs, milk, green vegetables, beans, and you can find it in some cereal grains that they do add to it. Now, niacinamide is also found in many vitamin B complex supplements along with other B vitamins. And niacinamide can also be formed in the body from the dietary niacin. However, it's not the same as niacin. So if you think, oh, I'm just going to go get the niacin, not so much. You'll probably get a really bad hot flash and just a flush all over thinking that you have nicotinamide. So niacinamide is taken through the mouth, preventing vitamin B3 deficiency and related to conditions such as pellagra, which is basically just a severe form of vitamin D deficiency. It can cause all sorts of other issues. Google it if you want to. But niacinamide, there's 6 things that I'm going to talk to you today that it can actually help with. So the first one we'll talk about is acne. Now, a lot of early research has shown that taking tablets containing that niacinamide and other ingredients for about 8 weeks does actually improve your skin appearance in people with acne. Also, research does suggest that when you have a cream with it, it can improve the appearance of the skin with people who have acne and the scars and the eczema. Same rules applies to any other skin conditions, and it's not just related to acne or eczema. The second thing niacinamide can help with is diabetes. Again, all of this is based off of research. So a lot of research is taking the niacinamide can actually prevent the loss of insulin production in children and adults at risk for type 1 diabetes. Type 1 is not it's not related to your diet. It also has been shown to prevent the loss of insulin and reduce the dose of insulin needed when you have type 1 diabetes, especially in adults and children. Again, type 1 diabetes, you really need to get that in control. However, the niacinamide doesn't seem to really prevent the development of type 1 diabetes. But people with type 2 diabetes, the niacinamide seems to help protect their insulin production and improves their blood sugar control. So basically, if you have type 1 or type 2 diabetes, the niacinamide seems to help control it better. Again, type 2 diabetes, you can control this with diet and exercise. Type 1 is just your body basically is attacking you and it can't control those blood sugar levels. The third thing niacinamide can do, it helps with high levels of phosphate in the blood. So this fancy term is called hyperphosphatemia, which basically is caused by when you have the high levels of phosphate in the blood, it can cause reduced kidney function. So people who have kidney failure, those are people who are usually on dialysis, and they do end up developing a lot of high levels of blood phosphate. And it's been shown that those people who have those kidney failure and they're taking the niacinamide seems to actually decrease those phosphate levels when they're taking with or without phosphate binders. So typically if you're on dialysis, you're taking those phosphate binders, but this has actually been shown that you can do either one and it'll decrease that. The fourth thing it can help with is the CNS, so the central nervous system. Now, there's evidence that nicotinamide may actually cross the blood-brain barrier in both directions, which is huge. And it's been long associated that with neural development issues, the survival and function in the central nervous system being implicated in both neural death and neural protection. Again, based off of early research, they haven't done a whole lot, but nicotinamide appears to play a role in protecting neurons from traumatic brain injuries, ischemia, and stroke, as well as being implicated in 3 neurodegenerative conditions that most of us are pretty familiar with, and that's Alzheimer's, Parkinson's, and Huntington's disease. So some new research out there is showing that this potentially, there might be some linkage in there that nicotinamide may actually help with some of these diseases. Not make them go away, but it can actually help with some of slowing the progression. The fifth thing that's good for is cancer. So research has shows that taking the niacinamide while receiving radiotherapy and a type of treatment called carbogen might actually help control tumor growth and increase survival in some people who have certain types of cancer, specifically with the larynx. And it also seems to help people who have tumors that the tumors are deprived of oxygen, and it potentially can help prevent new skin cancer or precancerous spots in people who have a history of skin cancer or that's the keratosis. So there's some actually pretty good stuff with that. So if you do have a history of skin cancer, or you live in a place where it's more prevalent, that might be something that you can consider. Now the last thing that it can help us is osteoarthritis. So taking that nicotinamide actually seems to improve joint flexibility and reduce pain and swelling in people with osteoarthritis. This is not rheumatoid arthritis, this is osteoarthritis. So it's kind of the big joints. Again, if you don't use it, you lose it. Osteoarthritis is the more common form of arthritis people have. Also, people who with osteoarthritis who take these nicotinamides actually seem to need to take fewer pain medications. So you take one thing and it can reduce the other. So with all of that, nicotinamide, all those tongue twisters, that's all I have for you guys this week. I will see you guys next time.